Dr. Sumana Moole here. Let's talk about diverticulosis, which has a couple of new recommendations recently that may be easy to follow and helps this condition. What is diverticulosis? Diverticulosis is the presence of pockets like little bubbles that are basically stretched out areas on the surface of the colon or the large intestine with time, generally found in people over the age of 50 and generally thought to occur as a result of a low fiber diet. And these pockets can get infected and cause pain and fever called diverticulitis, or they can bleed called diverticular bleeding. So what is new in this area? For a long time there was no change, but here is something interesting. About half of Americans 60 years and older are diagnosed with diverticulosis, and 5% of them will develop complications. It has been shown that maintenance of a low-risk lifestyle reduces the risk of developing complications such as diverticulitis. Now, what does that mean? Number one is reducing the red meat intake to less than 4 servings per week. Number two, increasing fiber intake to more than 23 grams daily. Number three, exercising vigorously for at least 2 hours or more per week, and maintaining body mass index between 18 to 24, and this is and not smoking. So these are the most important things that we see are making a big difference. And there's been evidence showing that somebody who's having a high fiber intake have cut down their risk of developing complications by more than 40%. Another stubborn myth we had in diverticulosis was avoiding nuts and seeds, and there's absolutely no evidence for that. Increasing physical activity seems to cut down the risk of developing diverticulitis by at least 34%. Some risk factors: NSAIDs. NSAIDs are medications anti-inflammatory like ibuprofen, Advil, Aleve, increase the chance or risk of a diverticulitis with a bleed. So it's better to avoid those. Lastly, an interesting topic: positioning while defecation or going potty. Sitting seems to increase the risk of diverticulosis as opposed to squatting. So the squatty potty may help to some degree, although it's not exactly a pure squatting position. There is a large study from Turkey that shows increased risk of diverticulosis with just plain sitting on the toilet. So when you're done, get up from the toilet or at least try to get a squatty potty. But yeah, these are definitely: exercise, eat more fiber, squat, don't sit.